Hi, I'm Cynthia Marks. I head up the Holistic Psychoanalysis Foundation established by my late husband, Dr. Bernard Bale. Welcome to And Now Love. Dr. Jason Coe is joining us today. He is a psychoanalyst, a psychiatrist, and a specialist in addiction issues. He is very well respected in the world of addiction treatment, and patients are constantly referred to him for help. We know how busy you are, for sure, and so appreciate your time. Thank you for being here.
Well, thank you for having me. I'm glad to be here.
You are one of the few who follows in Dr. Bale's footsteps, and I know how passionate you are about his work and how much you've seen it help your patients, and in fact, help you personally, right?
Absolutely. That's what makes a believer of me and anyone who has experienced Dr. Bale's theories and treatment.
Yes, to be able to take it in personally only helps you be able to expand and be excited about sharing it.
Yeah, you've got to feel it and you've got to connect to it. And it's truly a unique experience.
It is, and it is life-changing.
Absolutely.
Just for a little starter, can you tell us the difference between a psychologist, a psychiatrist, and a psychoanalyst? Just so we're all on the same page here.
Okay. Well, a psychiatrist goes to medical school and then does a training in psychiatry, a clinical training. They're medical doctors. They can prescribe medications. A psychologist goes through a PhD program. So generally, unless they've gone through a specialized program, they don't prescribe medicines. Some can under the supervision of a psychiatrist, but psychologists apply basically strictly psychological treatments. Now, a psychoanalyst can be a medical doctor or a psychiatrist or a psychologist. Psychoanalysis, in its strictest sense, is an intense psychological treatment. When Freud started it was 4 or 5 times a week. It still is in that way, but we've departed a good bit from that orthodoxy at this point. But psychoanalysis is, I think, important from the standpoint that it deals with the unconscious. That's what distinguishes it from a lot of the treatments that are popular today, like behavior therapies, cognitive behavior therapy, diabetical behavior therapy, DBT.
Well, my next question is about cognitive behavioral therapy because it's so popular right now. We were talking about this the other day. Can you explain that premise?
Well, it's what everyone is trained in these days. It's quick, fast, but behavioral treatment. They're not interested in what goes on in the mind or the unconscious, interested in what goes in to the mind and what goes out. They deal with people's distortion of their feelings. You know, somebody may have low self-esteem, for example, so they don't feel good about themselves, yet they might be very accomplished, very good people, but they can't feel good about themselves. So CBT and DBT would undertake to change those distorted emotional self-views.
And how would that differ from Bernard's work?
Vastly. Dr. Bale and psychoanalysts deal with the emotions and deal with what goes on in the mind, deals with the unconscious beliefs that make up the problem with self-esteem. So it gets at the cause rather than just corrects the behavior. There's a world of difference between managing your feelings and being free from managing, being where your feelings are just automatically guiding you through life. It's feelings that guide us through life. Feelings are our instincts.
So if I'm trying to deal with my self-esteem issue via cognitive behavioral therapy, would I be introduced to what triggers that and somehow figure out on a very surface level how to train myself to behave differently?
I think that's a good way to say it. It's retraining and how one handles feelings.
And then if I'm using Dr. Bale's methodology, I am getting to the thing that created that self-esteem issue for me, and I'm being able to release it by bringing it up from my unconscious and feeling something about it, and knowing then perhaps that that doesn't have anything to do with me. That's not me. I don't have to train myself to see something that triggers my self-esteem issue, because I won't have that self-esteem issue.
Yeah, what you said is, that's not me. That's a very important way to put it, because oftentimes when we see these kinds of problems, what we're seeing is the person is one or the other parent, or both parents in some way, and not themselves, not their true selves. So the goal is to release that so that we can be ourselves. It's a much longer, much harder process, but it's also much more lasting as well as satisfying. It makes for a better life. So does CBT. We got to give it its credit. And it can be very helpful for some people, particularly those who, I would say, aren't so sick.
It seems that almost all of us carry around some amount of trauma. Most of us don't have, a terrible traumatic issue or two to deal with it. Most of us have trauma that allows us to live our lives. We seem perfectly fine. We may not even know we're troubled. How do we help those people who don't even know they're troubled?
Well, nobody comes to treatment unless they're in some kind of pain.
And it may be something, it may be as simple as, I don't know why my brother keeps treating me the way he does, and how can I get him to stop doing that? Or my mother and I don't get along. I love her so much. She's not going to be here for much longer. What can I do to change that relationship? And those seem like small things, but if you dig deep, those could be signs of something bigger that you're just doing across the board. And once someone comes for one of those smaller issues, then they can likely tackle the bigger trash barrel.
They can go as far as they like. It certainly improves one's relationships, not only with oneself, but the people who are important to them. In this category of people that you're talking about that aren't so sick, maybe they're having trouble in their relationship or their marriage, or their children, or the boss or something. They begin to see, maybe middle-aged, late middle-aged, that I keep doing the same thing over and over, and it's not turning out well for me. They start to realize that there's a problem within their personality, and that's not going to respond to CBT. That requires a more in-depth treatment.
Wouldn't it be nice, and I think that Dr. Bale spoke to this, at least with me, if everyone from a very young age understood that they had a mother's imprint, and maybe this can happen decades from now, and that wouldn't be considered so much an impediment as much as something that you can attend to and you can work on through life. We just all come with this, and we're always going to be figuring it out, and we're not bad people. We just got this little extra bit of stuff.
Well, Cynthia, that's why we're talking today, is we want to educate people. Who better to educate but our young?
Yes.
And let them know from the beginning that they have this from their mother, like their mother got from their mother. It may not be them. That's the point of this treatment, is to sweep out the trash so you can truly be oneself. If they find themselves doing things that they don't want to do, or feeling things that they don't want to feel, or having complications in school or with playmates, something's wrong here.
Why do I keep doing this? It doesn't seem to do well for me. I'm not satisfied, but and a lot of us just keep marching on because, hey, that's what life is.
Yeah, and if we can reach young people, they have a lot of trouble with peer pressure, and not to mention, teachers and so forth, where there's a lot of pressure growing up. It's not as carefree and fun as we might think.
And I think becoming less and less so.
Oh gosh, yes.
Yeah, with social media and the pressure that puts on individuals.
Yeah, well, they're no longer individuals. They become social media automatrons. Oh, this is how I'm supposed to look? Oh,
Yes.
okay. Oh, I think I need plastic surgery. You know, people getting plastic surgery in their 20s. Really? But it's happening because they're supposed to look a certain way.
And be a certain way. And
That's
be
right.
interested in a certain thing. And obviously, we're very divided because of what we think we're supposed to be interested in, what we've been trained to be interested in via social media, etc. But I wanted to talk too a little bit about addiction and how you help people overcome that. And I say overcome rather than train themselves to deal with it so much, and maybe I'm wrong.
How I help free them.
Okay.
Just as we can be freed from the tyranny of our imprint and our parents, so can they be freed. There's a big difference between mastering it, controlling it, which is what AA and NA, Narcotics Anonymous, say, look, just don't use. It's CBT all over again. It's great. I think the most valuable part is the fellowship, where you bond with people who are on a similar path or mission in their lives, and that is to stop using.
Big support group.
Yeah.
So in your practice, does that come into play? People are working with you to free themselves and going to AA meetings? Or are they?
I definitely encourage meetings. They're very important because they need that support. The kind of people that come to my attention are seriously addicted, some for the vast majority of their life. So they need to get a whole new social group together for themselves. They have to leave all that behind. Everything has to change in their lives. You know, the people they hang out with, as well as their mind. Change can happen if you continue to use. You'll stay stuck, both socially and chemically. You're addicted. You gotta have it. First things first, you have to get them off the substance, whether that's a detox or whatever it takes. You have to give them enough time to dry out, whether it's alcohol or right now fentanyl, which is killing so many people. The whole point of using is to not feel the pain. We all, in our way, do the best we can to avoid pain. It's human nature. They talk about the high, but after they've been using for a couple of years, they don't get high anymore, but they get numb, so they don't have to feel. I help them to get more comfortable with their feelings. I take them as far as they can go.
And are you taking them as far as they can go via their dreams?
I do dream work. Generally, people will start to dream after they get clean. Certainly, some of them need medication to deal with their feelings being so overwhelming that they need some relief from that. They're pounded or bombarded with intolerable feelings. So we tap that down. We don't want to erase it like they were doing with their substances.
So those can be used in conjunction, Dr. Bale's theory, and in order to get to a place where you can actually listen to that work, some medication to take away the overwhelmingly terrible feelings.
Oh yeah, it's my theoretical background, and that approach allows me to understand people from all walks of life, all types of psychopathologies. So, and I bring in as much of that as I can. And some people take to it, some people not so much, but I think it appeals to everyone in some way or another. And from, you know, being a psychiatrist, psychoanalyst, and a dictionologist, it's so helpful to me to connect with them at an unconscious level with their feelings. And they get that, and that's the hook, and that's what keeps them going with me. So some of these cases have converted into very nice psychoanalytic cases who are doing dream work and who have a good amount of time being sober. We're all individuals, and we all go at our own rate.
And in the direction we'll go in.
Yeah, and we can't control our patient. All we can do is help them control themselves.
Do all addiction issues stem from the mother's imprint? Or let's say you go to the doctor and you've had this terrible back pain and you start being delivered the painkillers for that and it feels good and you become addicted. Is that still coming from the mother's imprint?
it does. For all the people who become addicted to opiates, and obviously plenty, there's an even greater number of people who just use them to treat their physical pain. By the way, they're very good emotional pain killers. But they don't all become addicted. Most of them don't.
Yeah.
So I call them sort of accidental addicts. But if once they realize it, that should be an easy person to treat. You just detox them and they go on about their life. But oftentimes it taps into a problem that they never thought they had, or they want to blame the doctor. Certainly some of that might be valid, but truth is they kept using.
So an addictive personality, which is this phrase that's out there all the time, is you could more say then that, like you were just suggesting, there's a group of people who take these medications for the back pain and they're never troubled by it in terms of an addictive issue. But those who then find that it soothes them emotionally are covering up or hiding away from something that needs to be dealt with. And it's just so much nicer to have that nice, numb feeling.
That's what they think. And opiates don't have a lot of cognitive problems, so you can function on them.
I see.
And when you're free from pain, you know what? I actually feel better. I can work better. I can concentrate better. But it catches up with them in one way or another.
So since addiction is growing, how do we turn the tide? How do we start to make a difference? I mean, I'd like to say that we just need to rush this information out and get everybody on board and inform all of them, but we can't do that fast enough.
I grapple with that question myself. It's a public health problem. Alcohol, unless you're just a flat-out terrible alcoholic from the beginning, it just kind of comes on gradually. That's the most natural course. And then you find by middle age, you're drinking every night and you're getting more than just a little bit bombed. But you're able to get up, go to work, but sooner or later that breaks down. The incidence of alcoholism is #1 addiction.
Are most of your patients coming to you with alcohol issues that kind of match what you just said, where they've reached middle age and now they realize they sort of can't get through?
Well, I see them at all ages, but yes, generally something happens in middle age where the bottom drops out. The job,
The
the
relationship.
marriage, and then that's a wake-up call, where the spouse is just, I'm not putting up with this any longer. Or the person realizes they can't. They can't keep going like this, or the consequences are going to be severe.
Or they start to have medical issues related to that.
Medical issues too, yeah.
So when your patients have gotten clean and the next step is this therapy with you, how do you see progress? How do you see them? I'm going to point to Bernard's theory. How do you see your use of his work helping them? Is it super gradual, or is it just dependent on the individual? Are people beyond getting clean, are they willing generally to take the next step, or is it just somebody told them they had to do this, they're clean, they know they can do this now on their own, they're back out at their job and living their life?
Some people, that's all they want. And if they can do that, God bless them. But
Can they do that?
some people can, I think. They seal over whatever pain they were numbing, and they're able to go ahead and function and get what they want out of life. Not everyone wants to go deep. Surprising as that is to you and I. A lot of people just want to keep it simple and superficial.
But how do they find another way to seal it off? I mean, if they were successful with addiction and they're able to kind of numb themselves so they don't have to think about it or feel it, what other way is there? That I can't think of one that works outside of Dr. Bale's work.
It's human nature again. I guess this is the best answer. Although most people do not get sober in AA, most people get sober on their own, just sort of go about their business. But there's some, for example, in AA, there's some people who go to AA, they're there a few years, they've got all they want and need out of it. They've built a life that's satisfying to them. They just go on about their business. There's some people who are devoted to AA their entire life, into being sponsors and taking sponsees, and they walk around with 10 years, and everyone goes, wow, that's a badge of honor and wisdom. Well, they know AA, that's great, and if that works for them, that's fine. So I guess another way to put it is the defenses against the pain become re-established. They're okay living that way. Shocking to you and I that they wouldn't want this, but there are people who don't. They can go on about their business. What Dr. Bale and I always talked about is how long is it going to take to change the collective imprint of society? Well, hundreds of years. But if we start with the youth, if we improve the imprint, we automatically improve everybody. If we treated our women, probably already said a lot about this.
Can always say more about women, how important they are, and if we treat them well, how that will make a giant change in this world.
That's right.
So for now, in order to get to the youth, we have to get to the young adults who are thinking about bearing children.
To the mothers, you bet. And they need to be treated well.
Across the globe, and that's
Across the
hard
globe.
to attain.
And especially during their pregnancies.
In general, when you're treating your patients who have had addiction issues and they want to come to you, do they usually recover well? Do they end up wanting to continue to pursue this type of therapy?
A good many do, yeah. I would say it's all a matter of the fit, my skill as well, that I can talk to them and connect with them about what's really going on in their lives. Why are they having trouble at work? What is it about their personality that gets them in trouble? Same for relationships.
And do you sense that any of these people then wish to carry this information out into the world so that it's not just exclusive to their own well-being, but they sense that they can talk about this, offer this up to other people that are close to them?
They refer patients. They
That's
refer
good.
their friends and family.
Yeah, well, and we've spoken here to a couple of young psychologists who are all about Dr. Bale's theory, which is so exciting. So they're very excited to help bring this to our audience and hopefully even more than our audience. And I'm just thrilled that there are some young people that are practicing via Dr. Bale's methods.
Oh, absolutely. We need more.
Yes.
Because that helps the imprint and gets the word out. We want to help the imprint and we want to educate the public.
I still feel, and I'm proud of these people who are doing this, that they are up against a wall in terms of their peers, in that this type of work is not really where it's at right now. I don't think there's any easy access to an understanding of Dr. Bale's work outside of Dr. Bale's little world. You can't go to school and learn about this yet.
That's right.
So it's impressive that these younger people want to walk this path.
Yeah, you know, we live in a society of we want quick, instant results. Psychiatry's pretty much turned its back on psychology. They consider themselves brain doctors. They prescribe medicines. They don't even know the patient. They see them 15 minutes, some even shorter than that. How are your meds? You know, maybe they ask about symptoms, and then move on. They don't know anything about their lives. You know?
That is so sad.
And obviously I'm not against medication, but by neglecting the psychological and the unconscious, in my opinion, they're being mistreated and done a disservice and harmed.
It seems to be just another way of pushing down or numbing the emotions or the feelings.
That's right.
So when you are treating your patients and you're seeing success, you know, little glimmers of an understanding, or you're helping them find out who they really are and watching them operate from that place, what does that do for you? How do you feel?
I love it, of course. I love it when I can connect in a meaningful way to a patient.
Are you able to learn from them how they interact with other people, and these patients that perhaps you've known for a long time, can you see a shift in their families in their communities?
Oh, yes. No doubt about it. It changes them, and it changes the people around them, and their lives become more satisfying.
Mm-hmm.
That's what it's all about.
So back to youth and education, this education that would be important so that our youngsters understand the trouble with addiction. Where should that education come from? From our parents, our schools?
Everywhere. The government needs to take the lead on this. There's a NADA, National Institute of Drug Abuse, and there's also a companion organization on alcoholism. It's all there. All the information's there. Why don't they put it out there?
So what is being done with all that information in those organizations?
This resides on the website. People who are interested read it. I don't know how many people read it.
Now, who knows of these organizations in the first place? Most of
Right.
us don't.
Like most things, they don't become politically expedient until it affects votes.
Is the United States top of the list in terms of the amount of addiction?
Gee, I'm not really sure.
Mm-hmm.
Probably. We have a way of bastardizing everything, taking it to the extreme.
Mm-hmm.
But to be sure, Europe has a lot of problems, no question about it. Asia is starting to be infected with it.
And in the United States, is it largely due to our leniency? Is it some way as a country that we behave and what we find acceptable? Are we in a place where we have to do more mind-numbing than other places?
I think so.
Mm-hmm.
We always want to push the envelope.
Yeah.
We're the leading edge of the Western world,
Mm-hmm.
particularly California.
Mm-hmm.
Absolutely at the Western edge, geographically speaking. Everything gets taken to the extreme.
So when a patient comes to see you after they've cleaned up, are your sessions with them similar to those that you have with people who come to you who don't have addiction issues? Do you sort of say, tell me what's going on in your life, and listen to them the same way you would with a person who doesn't have an addiction issue?
Of course.
Mm-hmm.
From the beginning, even when they're still using.
Mm-hmm. So you actually meet with the patients while they're still using?
Right, or who are in rehabs or getting detox. But some out there, yes, are using. I don't exclude them from treatment. My hopes aren't too high for them either. If you don't want to stop using, okay, let's talk about it. What's it doing for you? How's it impacting your life and your mind?
And for some of us, it will always be important enough to keep doing because there's some reason we don't want to get to what's...
They can't deal with it.
Mm-hmm.
It's too deep, it's too primitive, and it's too painful.
Mm-hmm. But really, we, humanity, has created that situation. We, as mothers, as caregivers, have created that world for that person where they're that stuck.
That's true.
Because it can't really come from any place else, right?
That's right.
Are some of us genetically inclined to have the possibility of being addicted to something than others, genetically, without reference to the imprint? Or it's really about the imprint?
I think the vast majority is the imprint. I think the imprint has the force and power of genetics. And this is to say nothing about the epigenetic and how the imprint changes genetics.
Mm-hmm. Can you, for us, describe what epigenetics is?
It's the modification of genetic propensities by external factors. It's not just the genes as they are, but they can be modified. I believe that Dr. Bale's theory, working on the imprint, modifies the epigenetic.
So you often hear that this person is addicted to alcohol, and so is their father and their great uncle, and so it must be genetic.
The whole families.
Mm-hmm. Isn't that just the ongoing imprint or set of imprints?
I think so. I mean, I always ask about family history in the context of not just getting the medical family history, but also the addictive history and psychiatric history and all of that. But it tells me more about the milieu or the environment that these people grew up in. Drinking was normalized.
Mm-hmm.
There are plenty of people who grow up terrible alcoholic parents, both of them, and they say to themselves, I will never drink. They don't drink. Now, usually there's another caregiver. They help them modify their imprint to see that there is some love out there and there is somebody who cares about me and who shields me from the violence and tyranny of my parents' alcoholism. They know that there's a different path. Somehow they get that. It doesn't mean they escape without deep wounds, because who wants parents who don't care about you?
But perhaps that loving support from outside that set of parents, it's something that you're not getting from those parents. It also shows you what it means to be without that addiction, that this kind of fabulous feeling back and forth, this is what I want, and those two over there don't have that, and I'm never walking that path.
Right. Well put. It's usually like a grandmother. I've also seen caregivers take over who don't want to be caregivers, and that's a very sad situation.
Struggle for that individual and that sort of care.
They just go from one bad caregiver to the next. Foster system's a good example of that.
Do many people have a good experience in foster care? Is it more positive than negative?
I don't know. Again, hard to say. I see the troubled ones,
Sure.
and I don't know the statistics, but
Yeah.
it's a rough scene. When you have to be taken away from your parents, that's a huge blow to a child. I think adoption is a huge blow. You know, once they find out, well, if my mother had loved me enough, she wouldn't have given me up. How could she do that?
But yet these children need to be cared for and, in the best of all worlds, loved by a new family.
Right.
But that new family has a big challenge, because not only do they need to raise this little person in the most loving way, they also need to be aware of this little person's imprint.
That's right.
It must be more difficult to get to that imprint when someone's been adopted, because you can't really see clearly a frame of reference, because they don't have it in front of them. It's not something they're dealing with every day, a mother, a father, a brother, an argument that brings to light some amount of trauma. The trauma is before you have this family. How do adopted people get to their own imprint?
Same way everyone else does, talking about it.
So it's the same thing where you may be interpreting a dream and visiting different ideas about that dream until that patient says, I think that's it, that fits, and then you can explore that. But you don't have any real world to refer to, like, oh yes, well now you can see that you don't have this self-esteem because your mother didn't ever feel like she was treated properly. If you know that birth mother, you could see that, but not knowing that birth mother, it's really important for that adopted person to really rely on what they're feeling.
That's true. You know, if they have good adoptive parents, it can make all the difference in the world. But it's still tough situation, because that's the imprint. I've seen some do well, though. I think that there are pregnant women who love their baby. It breaks their heart in a huge way to give up their baby, but circumstances demanded it. And then there's some that are just, this fetus, this child within me is a nuisance and ruining my life, more than a nuisance. I just want nothing to do with it. Get it out of me so I can go on about my life. And those are the ones that get the rough imprint.
That seems unbearable and a lot to take care of.
Maybe you don't get good adopted parents. Maybe you start to act up, become unmanageable, start having problems as a juvenile. Boom, you end up in the foster system. You know? They don't want them either. So a lot of things can go wrong, very wrong.
Well, we all have this idea of the perfect picture, 2 kids and a dog and a house in the suburbs, whatever that might be. But that might not really be our picture, and we might not do that very well because we are not doing what we're meant to be doing. We're doing what someone told us we should be doing. Just inside of those parameters, you're not being your true self, so you can't be a loving, helpful person because you're on somebody else's path, your mother's, your father's.
That's how it is.
Mm-hmm. Thank you for being here. I so appreciate you sharing your love of Dr. Bale's work and the positivity that you see it can provide to the world. Any ideas you have about getting this message out that you want to share with me, I will listen.
Well, first of all, it's a great pleasure to be here.
Thank you.
And talk about these issues. We could probably go on for hours in one way or another.
Yes, and I can't stay on track because you say one thing and it leads me down another path, and
right.
I really do need hours.
We can do it again sometime.
Okay.
But I don't have any great ideas about it. I'm not a politically motivated person,
Mm-hmm.
but we've got to figure out some way to make it popular and appealing to people. And probably the place to start is with our educators.
I think so. And perhaps a little bit here. We're doing this out of a love of Dr. Bale's work because we've had our lives changed by being able to apply his theories to our existences. And we're not doing this for money or to get votes or anything. We're just wanting to share this beautiful bit with as many people as we can. And if we can catch on to a few people who can share it yet again, and those people can bring it back to their therapists or talk amongst themselves or think about their dreams, we're at least going to try for that here.
This is the beginning.
It is. I hope so. So thank you again, and thank you, audience, for listening to us. Let us know if you have questions, and follow us and keep listening. Thank you.
Thank you.